Today, we are having one of my favorite conversations with one of my favorite guests. Dr. Andrew Feifer is back to talk about water, everything you need to know and didn't know you need to know. Welcome back, Dr. Feifer. Hello.
It's a pleasure to be back. It's always a treat to talk to you, Gina, and to support your members.
Now, I know you've been with us for a while, but we do have a lot of new members who may not be familiar with you. So can you do a little introduction, who you are, your area of specialty?
My pleasure. As you mentioned, I'm Andrew Feifer. I am a urologic oncology surgeon, urologist with specialty in oncology. I'm in the Greater Toronto area and spend majority of my time professionally taking care of patients with a variety of urologic conditions and primarily in the cancer area. But I'm also, as we like to say, a human plumber. Look after the plumbing.
I love it. So you've been with us for a while, but you're very familiar with the program. So I know people have a lot of questions, like, this amount of water Gina is suggesting to drink and what they're asking us. So just to reinforce the fact that you are very aware of what we do here on Program and Plan and what the app is.
Yeah, I mean, I came into this. I was a member of the program, and I'm currently doing the program right now. And I mean, I struggle with a lot of the questions that a lot of members are still talking about water consumption. And I looked at it from both a member standpoint and also from a professional standpoint, trying to meld these together and get and really support my own participation with evidence and personalization. So I would say that I'm intimately familiar with the program and so on.
So number one question, why is drinking enough water important? Let's start with that. I know it's basic, but it's a loaded question.
Yeah, it's the question, to be honest.
Yeah.
So water serves as a foundation of really that everything but serves as the foundation for everything that happens in your body. You need water to live. You need water for all the biochemical reactions that happen in your cells that make your body function in all the normal ways that we expect it to function. It supports your circulation first and foremost. It supports your the transition, your oxygen movement throughout your body. You can't survive without water, and I would say you can't survive without water, but you can't thrive without the right amount of water.
Yeah, so we suggest that a recent Harvard study came out, Mayo Clinic, the 2.7 to 3.5 liters for the average person, basic body function. We get asked all the time, how much do I need? Why would someone need more and why would someone need less?
So, water consumption is very personal, right? You have to do what's right for you. What's clear about it is that there is a basic level of water and fluid that you need to survive. So you lose water when you breathe, you lose water when you go to the bathroom, when you eliminate solid and liquid waste, you lose water in the natural enzymes that flow into your gut. You lose water through perspiration, especially if you work out every day and you're trying to keep fit. The water loss through perspiration can be significant, very, very significant. So all of those things, you start out at a certain level and you're dropping, as the day goes. So it's incumbent upon you to really fill that up and keep that water, that consumption at that level to maintain your body functions. So people who need more water are those who are vigorous, who are vigorously exercising, for instance, or who have conditions that make them lose a lot of water, for instance. Those who need less water are those, for instance, who are on medications or have medical problems that do not permit that as a result of their body not being able to process a lot of water. So those patients have to be a little bit more, those members have to be a little bit more careful in terms of their water consumption. So that's why I think you guys do a great job at personalizing the water consumption for each member.
Yeah, it's relevant person to person. So I always say, someone says, well, I can't drink what's recommended. Is this program going to still work for me? Their body takes those limitations. So how much someone needs is how much they need. If they are restricted, it's not necessarily going to factor into their ability to lose weight. It's just they have to do what's right for them. So it's not more and more and more, my point is. So someone who's physically unable to drink what is typically recommended, it's not going to be impossible for them to lose weight.
Well, I've always said, the plan, which again, I'm familiar with, and all the different, things that you talk about, our water is only one aspect of that, right? So you do what you can, you maximize to your personal ability, yeah, and you focus on the other aspects that you can do. Maybe you are a person who can do, other things in the plan and maximize your consumption of just as just as you would say, but water, you have to do what's right for you, and that's really the most important thing.
So we've had this conversation before, and one of sort of those aha moments that I had was about the fact that because you're eating more often, you need more water. Like if you're just eating a couple meals a day or following on with a diet or whatever you're doing before you got in here, you might not necessarily have needed as much. But one of the reasons why you do need a little bit more is to support the process in your body while you're focused on it, is because you're eating so often.
Yeah. So digestion in general requires a lot of water. Your body's pouring in all these enzymes in your stomach, in your intestine, all the way down through your colon, and exchanging water for metabolites and diffusing the good stuff into your body, absorbing the nutrients and getting rid of the waste. All that is mediated by water. So the nutrients go in and the nutrients come and the waste comes out, all dissolved in water. So without a good amount of fluid, right, that your body can rely on to perform those exchange of minerals and all those things, and get your pancreas and your liver to put in all the enzymes to digest, all that is water based. So you have to be able to consume a good amount. You don't need to be overdo it, but water consumption, just like everything else in your body, in your own homeostasis, water promotes good absorption, good digestion, and promotes your circulation and everything of the sort.
So let's look at that from a different angle. So that's obviously what you need water for. So then what happens, just to frame it differently, when you're not getting enough? Like what are the issues with being dehydrated?
So when you're dehydrated, your body sucks in water from every place that it can to support your circulation. Because the number one thing is your body is your blood pressure, and your body needs to support your blood pressure. That overrides everything, So when you have a certain amount of water in your diet, or you're well hydrated, your blood pressure is good. Your cells can say, okay, we don't need to relax. We don't need to release our water into the big veins and the big arteries, and I can just keep the water and focus on being the best cell or best tissue that I can be. That's really what goes on. But once you're dehydrated, that your body sends messengers to basically your entire body, and through these pressures, the water just is sucked up into your general circulation. So your tissues are dehydrated. So you may see your skin be very, very dried out, for instance. You may have your other internal organs not function the best way they can, because they're not well hydrated, they're not robust. And I know you've asked this question in the past. Well, what can you see when you go to the operating room?
What do you see? Yes. What do you see? Can you see dehydration?
Yes, you can absolutely see dehydration, and we see it all the time. In fact, one of the most fundamental pillars of surgery is hydration and electrolyte management, because you cannot do good surgery without a well-hydrated patient, without somebody who's supported with fluids and so on during an operation. So you see flat veins, you see water that's not, or blood that's not being brought up to the heart naturally. So you can see dehydration. So fluid and supportive circulation is sort of a fundamental thing of what I do. And as a urologist, we see this a lot in patients with kidney abnormalities and all these different things. So I can't stress enough the importance of really maintaining your hydration.
So we're going to get into the conversation of too much water and who needs to be worried about that. But would you say, because I still want to stick on the conversation of dehydrated, because I want to bring up this study that you sent to me. But would you say that, like, what is more of a concern? Like, I know maybe overhydration might be a concern for people who need to be mindful of that. But what do you think is a larger, more systemic issue? Dehydration with people, or the concern of overhydration? Because people come to the program and you take people who don't drink any water, survive on coffee and a diet pop, and that's it. And they're so concerned about, oh, I can't drink too much water. What if I drink too much water? When I'm thinking, most people should probably be concerned about not getting enough, not the other other way
Agreed.
around.
Agreed.
Yeah.
So, yeah, there's two populations. There's the minority population, which we tend to see in medical offices, where patients come in and they have problems with their physiology, and they they're on medication and different things that alter their water metabolism in their life. That's one group. We'll park that for a second. But then there's
Okay.
the majority of people who again, like you said, coffee and diet pop, and they all of a sudden they're expected to drink they or not expected, but they are encouraged to have a safe water consumption for them, and they go to the bathroom more often. They're frustrated because this changes the way they are. Now, we've talked about this in the past also, where your body has these sensors, that determine how much, what your concentration of your blood is, what your blood pressure. These sensors are in your neck, right here and here, right? There's in the big veins in your neck. And what these sensors do is they tell you if you drink a lot of water. If I drink a liter of water right now, and I'm not working out, my sensors are going to tell me that I have too much blood volume, that the water is there's too much water in my body, and as a result, my blood pressure is supported. It's time to release some water, so it's going to send messages to my heart and my kidneys to make more urine to pass out the water naturally. That's how it works. So with that, right? People who are tonically dehydrated, their sensors are set at a very low point. With effective and safe consumption of water and increasing your hydration towards a healthy area, your body resets. So there's a bit of a bump, that you have to get over to your body to reset. And I know that in the program, I think you talk about more of a consistent consumption of water throughout the day, and not sort of a liter after liter, binge water drinking, I would say.
Yes.
So I think that also promotes that. So that is a much healthier way of getting your water and your fluids in than drinking a liter with dinner, a liter with lunch, and and then a liter with breakfast or something like that. More of a consistent pace, which helps your body adapt to this new healthy level of blood volume and concentration of your blood.
Woo! So this is why when people go from not drinking a lot of water to increasing their water, even perhaps when they're spreading it out, that they're kind of, their body is set around a certain amount of water and saturation. Would you call that saturation levels?
Saturation is a good, absolutely. Sure.
So it's set lower. So when you try to go above that, you're feeling the effects. Is this why people may all of a sudden start peeing more often?
Exactly. It's like when, I think you can make an analogy to weight loss in general, where your body is set to a certain barometer where you have to change things in order to lose the weight. So it's the same thing with water. Your body is just used to a certain level, and you have to slowly over time change the way your body functions. And part and parcel with macronutrient consumption and things of this sort, water's part of that.
Ooh, I love this conversation. Okay. So let's talk about those saturation levels. Obviously, you don't want to drink too much water. Like we say, avoid drinking a liter in an hour, like really spread it out. But then what about electrolytes? Like, if someone's drinking more water, should everyone be adding in things like trace minerals, making sure they're getting enough salt? I know historically people are like, you don't, like, salt is bad. Salt is high blood pressure. Salt is all these things, but you actually need salt. And when people do the program, they tend to not get as much salt in, not as many processed foods. So do you think, like, should everybody be mindful of that, or just some people need to worry about that? Just drinking more, adding in more, to support?
Totally agree. I think that, when you drink a lot of water, there's a risk, a small risk, that if you drink an overabundance of water, I'm talking many, 10 liters of water, that your level of sodium will go down a little bit in your body. So that, of course, is not a great thing. It can lead to some other things. And the most important thing I would say is that people who that happen to sometimes are susceptible because of medication they're on, or problems with their health, people with heart failure, kidney problems. We always stress that you have to decide what's right for you, and what's right for you is based on your own personalized health And
Mhm.
there's no one blanket response for everybody. You have to speak with your physician about what a safe level of consumption of water is. If you're on things like diuretics to maintain your blood, to control your blood pressure, or if you have ever been told that you have a heart problem, things of this sort, those are really important things to focus on. So, but for the general population, there have been plenty of great studies that have come out to show that maintaining a very healthy level of sodium in your diet is a very important part of your physiology. So
Right.
when you think things like trace minerals are very, very important. If you like, your body is, let's say, concentrated at this level, okay, and if you drink water that is concentrated at this level, okay, and it's much less concentrated than your body, then that water is going to go into your body and bring down your concentration. That's really what
Mm.
happens. So
Yep.
the trick is to raise that level of concentration of what you're consuming, right, where it almost matches what your body's naturally made of. And then you have this free exchange of water going in and out in a safe way. You support your circulation, you support your organs, and you don't worry about big shifts of water going
Mm.
in and out of your circulation, your cells, to lead you with things like low sodium and so on and so forth. So that's really the most fundamental important thing.
So if someone is drinking what they think is the right amount of water for them, and they've given their body time to adjust to this newer amount of water that they're bringing in, and they still find that they're going to the bathroom, what seems like, more often than normal, would that be because would they benefit from adding in those electrolytes or making sure they're getting enough salt, or would that be something else like stimulants or irritants like coffee or alcohol or
Yeah.
something?
So it's funny how many people are not fully aware. I mean, I'm sure you are, that stimulants like caffeine play havoc on the bladder, for instance. Caffeine does two things. Number one, it acts at the level of your kidneys and it makes your kidneys make more urine. So if you
Mhm.
make more urine, you're going to end up having more urine in your bladder more often. You're going to go to the bathroom more often. That's the first thing it does. The second thing caffeine does is your bladder it's like a sphere and it's made of muscle. And the way you actually urinate is your bladder squeezes, the muscle squeezes the urine out. It's not just a passive drip and it doesn't just fall out. It's actually pushed out by your bladder. And caffeine makes your bladder very twitchy and unstable. So normally, a normal person will have their bladder expand into a certain level. Everybody's different. Usually, for an
Yeah.
adult, male or female, between 4 and 500 cc's until you feel you have to go to the bathroom, and that's your bladder nerves sending messages to your brain saying, "Okay, I got to go to the bathroom now because I'm full." But
Yeah.
that mechanism is diminished dramatically, so you end up having to go to the bathroom more often. So if you're drinking more water as part of the plan or as part of a general approach to life to maintain your hydration, it may be advisable for you to just take a quick look at how much coffee you're drinking, for instance.
Mm.
Decaffeinated products might be a better choice for some parts of the day. I mean, everybody likes a cup of Joe in the morning. There's nothing wrong with that. There you go. But the truth is that those stimulants like alcohol, even spicy food sometimes,
Oh.
and caffeine can really cause irritation to the bladder and make your bladder more contractile and less hospitable to the activities of daily living. So
Is
that's
this an age thing? Because I was just talking to Dr. Feifer before our chat that I've been having some sort of bladder issues where I almost feel like my bladder is being irritated when I'm drinking coffee or alcohol, which is why I've switched to decaf. But is it an age? I'm turning 50 this year. Is it an age thing? Because our demographic, I'm just kind of like thinking back, our main demographic is that 45 to 55 range. And then we go 35, 45, and then, 55, 65, and then down to the younger range. Could it be that, people coming into this program, a lot of them have done all the diets and they've done all the things and they're ready to do it a different kind of way, which comes with experience, maybe with age. And could it be that at this point in people's lives where we're suggesting that they do increase their water than what their body is used to, that this is maybe like they're kind of like unraveling maybe some pelvic health issues,
Yeah.
like
So, we did talk about that. I mean, pelvic health in males and females is one of those things that you don't know about. You don't think about it until it goes wrong. That's the
yeah,
problem. And it's one of these things in life, like breathing or like lifting your arms, or doing whatever normal thing that you do, that until it's gone, you're like, wow, that was really an important thing in my life that I just took for granted.
Yeah.
Pelvic health is a grab bag of things. It's about successful and safe elimination of waste, both liquid and solid waste, to make sure that's effortless and make sure you get all those toxins out of your body. Number one. Number
Yeah.
two, it's in many times it's sexual health, both male and female sexual health. All those things are tied together in the pelvic floor and what you're consuming, what you're bringing in. It could be due to stress. Also, stress has a dramatic effect on life and pelvic health. Things, even things like what medications you're on or what other medical problems you have, things like this. Also, depending on where you are in life with respect to, a lot of females will struggle from something called genitourinary syndrome, which is a syndrome that leads to a lot of pelvic floor dysfunction or pelvic dysfunction in general, and that can usually happen in the perimenopausal patients and so on. So a lot of different things can happen and change your hormonal balances, which dramatically affect the integrity of your tissues. Can really play a central focus in how you experience your pelvic health. Now, elimination, the things that are low-hanging fruit, right, are taking care of your elimination, drinking a good amount of water, making sure that you speak to your physician about any sexual dysfunction you're having, things of this sort. There are things and treatments that are effective. Now, why is this related to water consumption? Because water consumption improves all of these things. It improves circulation, your circulation to your pelvic floor. It improves your elimination of solid waste, and certainly improves your bladder function by allowing it to cycle properly.
Woo! Okay. Weak bladder. Like, could your weak bladder be a sign of, so many people, my bladder's this weak, my bladder's this weak. Is that a thing? Or are they just noticing that their body just needs time to adjust their water? Could this indicate that they have something else going on? Like, some people seem to be more sensitive to having to go to the water more often than other people.
Absolutely. Aside from the getting used to having more water in your bladder and going to the bathroom more often, there are many things that can happen to make a bladder less hospitable to that amount of water. Things like overactive bladder, which is a very common thing. It's like we talk about the COVID-19 pandemic. Bladder overactivity is a pandemic. I mean, it's everywhere, men and women. So overactivity to the bladder, things of this sort. If you've ever had surgery or ever had, God forbid, chemotherapy or radiation for anything down there, that can dramatically affect the bladder. If you're on diuretics or medications that there are certain diabetic medications that will absolutely positively, especially in the weight loss population, make you go to the bathroom often, no matter what, even if you don't drink water,
Right.
So because you're eliminating glucose in your urine, getting rid of that extra sugar, and it's the sugar is pulling with it the water. So that's what happens. We see that very, very often. There's tons of stuff.
So on that, so what happens as we get older? And I have to, it's not just drinking the water; it's that sense of urgency to pee. Do you know what I mean? Or is there where do exercises like Kegels and stuff come in? When you
Yeah. I mean, Kegels and pelvic health, everybody should be doing Kegels and pelvic health, pelvic physiotherapy as part of their natural approach to wellness, pelvic physiotherapists are very highly specific types of physiotherapists. There's a great website out there called pelvichealthsolutions.ca, which you can find a pelvic health guru near your house. You don't have to go far. And looking at Kegels or enhanced Kegels or pelvic floor rehab, all those things to improve your pelvic floor, your contraction. It's like the pelvic floor is like any muscle in your body. If you don't work it out, it's going to just dither away, right? It's like it's made of the same thing as your biceps. And if you don't work it out, it's not going to work well when you need it. And when you need it is when you're changing your life. You're expected to hold in that urine so you don't have any accidents, for instance, things of that sort.
So on the other side, I don't think I've ever asked you this before, and I've heard it, but it's just kind of that thing out there, holding your pee. Everyone always says, "Oh, it's so bad for you." So, how detrimental is it to hold your pee? Like if you're holding it every now and then, because I'm at the grocery store and I got to pee, I don't want to use their bathroom, and I want to, I want to get home. Like, what
It really depends on how often you do it, to be honest. Like if you're holding it once, or once in a blue moon, it's not going to hurt you. But if you do it chronically, I mean, we have this thing in urology. We talk about the teacher's bladder or the nurse's bladder.
I was thinking of teachers drinking
or
more
the
water.
nurse's bladder. Nurses are scrubbed in with me in the operating room that can't go to go to the bathroom, and their bladders end up getting really dilated. So what happens is the bladder, again, is like this muscle. So if you don't work this muscle out, what will happen is that it's going to dilate like a big balloon, and then sooner or later in life, it's going to have trouble emptying. It's like that balloon that you blow up, and if you blow up a balloon like this and you let go, the air is going to go out right away. But if you blow up a balloon that's like this and it stretches out over time, it's not going to empty, and the resistance of the bladder is diminished when the capacitance goes up. So it's really a fine balance of trying to go to the bathroom. I always tell my patients you have to go to the bathroom by your watch and not by feel. If you feel you have to go to the bathroom, it's not the best thing. So go to the bathroom during the day.
What? Hold up. Say that again. What?
So we call it. I mean, it's very simple maneuver called time voiding. So you get your watch, get your your Apple Watch or whatever you use, and put on an alarm every 2 to 3 hours. You go to the bathroom if you need to or not. You may, some of your members may say, I go to the bathroom much more than that. That's perfectly fine. But on a regular day, you should be going to the bathroom every 2 hours by feel to keep your bladder empty and then cycling effectively. And when you go to the bathroom, as you mentioned before, try to, if you're a woman and you're seated when you're going to the washroom, you stand up, you get right back down, and you try to have a second void, because often there's urine that stays there that doesn't empty the first time, and a second void or a double void will really help you try to empty your bladder effectively. Now, the more a bladder is empty, that one, the less time you're going to spend going back to the bathroom again an hour and a half later. So try to make every void count, which is what it's about.
Well, yeah, because I find sometimes I go to the bathroom, then I get up, and 5 minutes later I have to go again. I'm like, what?
Yeah,
so go and then stand up and then go again.
Yeah, with time and life, things shift. Your anatomy is different than it was, when you were younger. It just takes a little bit of time to adapt to that. It's one of those adaptation mechanisms that we have to do as people who have had some experience in life, and however your age, whatever your physiology.
So back to those teachers then, what they would want to do is make sure they're on a schedule of going to the bathroom and taking the time to do that, especially while following the program. Even though they may not have to go at that moment, they should take that opportunity and go.
They have to, if you were a teacher and and you're not allowed to go to the bathroom or whatever it is because you have kids and you have nobody else that's there to help, there's got to be special mechanisms to help you with your health, because it's a health issue. It's like taking medication on time. It's a health issue. So yeah, for sure.
Wow. So, now I need to add a P notification to my app to remind people to set those notifications to go pee. What about breaking the seal? What is that all about? How come I could go and not have to go all day, and then all of a sudden they break that seal, and damn it, every 5 minutes I'm in the washroom.
That has to do with your consumption, and has to do with how much fluid you're drinking at that moment. You're more likely to have that happen if you're drinking a good amount of fluid all at once, or if you after coffee, for instance. People say, "Oh, I drink a coffee, I have to go to the bathroom 3 times." It settles down with time, but it's about the stimulation. That's why the consistency of water consumption will lead to less sort of aggravating experiences where you have to go to the bathroom more and more often.
Yeah, I mean, thinking back to my university days where I'd be drinking, you drink and you drink and you drink and you drink and you drink, then you're at the bar and you don't want to break that seal, because as soon as you do, you're in the bathroom all the time. It's probably because I'm drinking more. I'm also drinking alcohol, probably, which is that stimulate, and then that's causing me to go, okay. Woo, love this conversation. Okay, so let's go back to the study about, basically, drinking more water, drinking enough water can help you live longer. Can we talk about this?
Yeah, sure.
People did reach out to me and they're like, "Oh, did you hear this? Did you hear that?" So let's talk about this. I think it's important.
Absolutely, it's super important. Just one brief thing: you have to be careful when you read studies like that to interpret the results well. I went to school for years learning epidemiology to be able to take that and dissect that and really distill it down to really what the crucial message really is. So as we said, and as you espoused in the program, water is a partner with health. So it's a partner to, to good nutrition, all these things, and serves as a good modality to really enhance your physiology. So that's clear. What we have in that study is really the first time where we have a well done, large population study that shows that if you have sodium levels that are too high this time, right? Meaning that your water consumption or your hydration status is low, because sodium is a reflection of how much water you drink. So if your sodium is high, you're not drinking, it's not dilute enough, meaning you're not having enough water. So if you do not—
can I just cut you off for a second and really point that out? I think it's so important because people are so concerned about low sodium, too much water, not enough sodium, and blood pressure, right? Like if you're too much water, not enough sodium. And then the opposite of that is having too much sodium in your system and not enough water, which is a whole other issue. So it's just so, oh gosh. Okay. Sorry.
Yeah. So absolutely. So now we have an association, not a cause. Like high sodium causes you to live, shorter period of time. It's not an exact sort of causal relationship, but it's a highly, highly valid association. So what does it mean? It means that people who do not focus on their physiology, focus on maintaining their bodies in an optimal state, which has water consumption as an important foundation. People who are not supporting their circulation, not supporting their enzymatic reactions and their body's natural cellular mechanisms with an appropriate personalized amount of fluid, live shorter than those who are optimally saturated with fluid. So it's the first time in a well-done— there's been plenty of studies before that have alluded to this, but you can always take apart those studies by looking at the methodology of those studies, that they were really actually poorly performed studies. This study is the first one that has sort of the epidemiology stamp of approval on it that says, look, it was well done. The groups were well balanced. The associations were well measured. And as a result, the conclusion that you can make from this study is a valid one for the general population. So it just means that fluid is a part of wellness. If you focus on wellness, you focus on eating well, physical activity, not drinking too much alcohol, not smoking, things of that sort. Fluid is right up there with maintaining your body's natural tendency to when pushed, to perform optimally. That's it.
It's just such an important part of our health and wellness and how our body functions in general. Like it's so, I love this conversation. Seriously, because I've been talking about water and not drinking enough water for a long time, and there was that no, you only need like 6 to 8 cups of water, and I'm like, no, like that's big, like the bare minimum amount of water that people need. And to really, it's all about framing it to make it resonate with people and how important. It's such a simple thing to do, but it's such an important thing that we need to do. I'm cognizant of our time here. Can we just talk a bit about overhydration again, just to be super clear on that? Who would need to worry about overhydration? Like, I just want to be very clear.
Super important.
And it is. Can we talk about how serious that is and why? Because, we post a post on low sodium and we let people know about this. And then we always have people who come, throughout the program, be like, everyone needs to know this. I went to my doctor, my sodium levels were off. And so like we try to tell people, but I don't think they understand like how important of a topic it is. And I don't want to deter, obviously say you need more water and then be like, be afraid of water. So not be afraid of more, but I want to provide clarity on this particular topic.
I salute you for this effort, because this is a very important group of people that need to be aware of this, and as do the general population and all members. So the most important thing is to personalize your water consumption and understand really what's safe for you. If you are a person who's experienced, unfortunately, congestive heart failure or kidney abnormalities, kidney stones, all these things that are on medication, such as diuretics. Diuretics are medication that reduce your blood pressure by making your kidneys make more urine. So you eliminate body fluid through your urine via diuretics. That's what they do. So those patients, particularly, especially those who, for instance, if you have patients who are trying to get well, if you have members who are trying to get well and they're suffering from health issues now, such as chemotherapy, radiation, unfortunate diagnoses of anything, they need to speak to their doctors about what a safe consumption of water is. That's very important. And they need to focus on not only water, but all the other amazing aspects of the plan and the program that will support them through their journey. If you are drinking the recommended amount of water per day, and you're experiencing any symptoms at all, which I think is extraordinarily rare, because you're not in that other population we talked about, then again, reach out to your doctor, reach out to the team. Understand you have wonderful people that work with your group that will give your members recommendations about what to do and when to seek medical attention. So I think that there is a safe range of sodium that you can deal with, right? I mean, sodium is not just one number, and everybody's number is different, and everybody's number is different on every given day. I mean, that's the thing. If you get a blood test on one day and say your sodium is 130, and your doctor says, oh my goodness, your sodium is 130, you're drinking too much water, who knows? That sodium may be back to 132, 133, which is perfectly normal, right? The next day. And it just may be that. So the sodium is not just one line. It goes up and down like this. If the sodium goes down to a point where it's dangerous, that's where you want to sort of intervene and curb that perhaps excessive water intake in that person's particular situation. But it's by far and away, it's a rare situation. And the recommended amount of water on the program is commensurate with what is recommended by medical standards everywhere. The program is not telling you to overdo it. And we're certainly at this point not telling you to overdo it, and to seek attention by your family doctor or your specialist should you have any specific concern for your particular thing.
So someone would either have known health issues where they would know they have limitations with the water, or they start drinking more water and they're, going to the bathroom more often, which could be just a matter of, spreading it out, having your body adjust, adding in some more, electrolytes or whatever to your water. Or if you feel there's something else, it could be unraveling, some pelvic health issues in which, always when in doubt, go check with your doctor. I find it interesting though, that, you have this study that talks about how important water is, but then you have these medical conditions that limit the amount someone can drink. So for my own personal interest, like what's happening there? Like, you would think if someone has these issues and water is so important, they would want to drink more or need more and not actually have to be mindful about the amount they're drinking. So is that just like getting their body has a disconnect somewhere? What is that about?
Yeah. So unfortunately, I mean, let's take the example of congestive heart failure, which is a really significant example. It's like, it's hard. It's where the pump in your heart is not pumping as well as it could be because the heart wall is weak. That can happen from viruses. It can happen from typically what's called coronary artery disease, where you have diseased arteries and the blood flow to the heart muscle is not good. So basically the heart muscle is starved of blood and sort of shrinks with time. All these conditions can affect the way your heart is pumping. And as a result, when the heart squeezes, less amount of blood comes out. So if you have an overabundance of blood in your body, your heart can't pump fast enough to circulate that blood. And as a result, you need to decrease the amount of blood that you have circulating so your heart can optimally function at its level. So some of those things, unfortunately, are not curable. You can manage them as a chronic disease, but they're not curable. I mean, if somebody has an opportunity to cure congestive heart failure in life, that would be a Nobel Prize winning achievement. That's just it would be an unbelievable thing. So when somebody has been down on, let's say a poor lifestyle for years, or not even somebody who's just got a bad virus from the population and has suffered from congestive heart failure, those patients cannot drink the same amount of water as every other person. That strict water adherence is the most fundamental part of management and needs to be overseen by your cardiologist for sure. Right. So it's very tight. So somebody can't come on and just start doing all the water and so on, because it's just not, it's not the right thing for them, and they're going to be in trouble. So that's what we talk about. That just, you have to personalize it. You have to speak to your physicians, you know? But for, those patients and those members are, you know, I know that there's a big focus on them as well. And you try to help everybody succeed in their journey, in their weight loss journey. And it's funny because weight loss is such an important part of congestive heart failure management.
Yeah.
That's what's frustrating about it, right?
Yeah.
But so you know, diet manipulation and following the program may be of paramount importance in those patients, as opposed to the water aspect of it, trying to really maximize everything else. So, you know, and really that's what it is. But for the rest of the population who want to preserve their cardiac health, want to make sure that they're alive and healthy into their 80s and so on, safe water consumption, making sure that you're eating well and focusing on your health and your overall wellness. A lot of things that the program really supports is really the most important thing, Gina, for sure.
Yeah.
You know?
Yeah, water's important, but it's not the be all end all in someone's health. And, you know, people will have their limitations. Right now we have 28,000 people in this particular group. You know, there are bound to be people, because we are talking weight loss, who are dealing with some health issues and who are taking medications, that this is a very important conversation. But even if you're fully functioning, healthy as possible, if you're not drinking enough water for yourself and your individual needs, that also is a really important conversation. One last question here. Does the kind of water we drink matter, or you're just like, get the water in? Like, there's so many different reverse osmosis and alkaline water and this water and that water. I'm just like, man, just get it in, maybe get a different variety of water. What's your opinion on this?
So it's all quackery and pseudoscience. That's the truth. There's never been a study, as again, I'm an epidemiologist, I'm a scientist, I look at evidence, and there's never been a study that shows that alkaline water does anything more than regular water. There's never been a study that shows that if you get, you know, reverse osmosis is the water that you get in a desalination plant in certain countries of the world, right? So there's nothing wrong with reverse osmosis as a process to get potable water, but it's the same. But we don't need reverse osmosis in Canada, let's say, because we could turn on the tap and have some of the best drinking water that we have that's available in the world from our tap, right?
Yeah.
So I think that, if there's certain waters that have different mineral contents that taste a little bit differently, and if you're very particular to the taste of your water, I think there could be an argument made to say, if you like this brand or that brand, if you like to buy bottled water, but water is water is water. And that's what it is. But I would tell you that, things like trace minerals, getting your electrolytes in, things that you espouse yourself, are a phenomenal way to balance your water intake with the right amount of salt and mineral content to make sure that what you're bringing in is what your body needs and not less or more.
Woo! Yes. Okay. Love that. What about carbonated water? Like, to me, my issue is like, just drink the water. But you know, if you want carbonated, drink carbonated. I find it makes me gassy, my belly upset. Like, thoughts on that?
Yeah, it's the same thing. The carbonation in water is just carbon dioxide that's dissolved in the water, and your body literally it's absorbed by your intestine, and you breathe it out as you would any carbon dioxide that your body metabolizes. And every time you take a breath, you're breathing out carbon dioxide every time. So that just comes out. It's not a big deal, and some people burp it out. It's whatever it is. It doesn't make a difference. And, I think, it's based on personal taste. That's the truth.
Right. Okay. Thank you. I know you're a very busy man. We are so grateful for you taking the time and having this conversation. So important. Just your most important thing you'd want people to know.
Most important thing, sticking to the plan in terms of water consumption is a safe thing. You start the day dehydrated, and you got to fill up that water in your body to really maintain your body's functioning normally. And you don't need to overdo it. You need to do what's safe for you to make sure you're well hydrated and that you support all the other important aspects of the plan. Because I think the plan is great, and I've done it and it works, and I've seen so many people do it. And that's what I would say. Just focus on this being one aspect of the overall life change that on your journey towards weight loss.
Yeah, such an important and amazingly informative conversation today. One of my favorite.
Listen, one last thing, and I know I told you this before. It is a pleasure for me to talk because I spend the majority of my days talking to people who have already had some very major life things happen to them with cancer and otherwise. So the ability to reach out to people in this manner in a wholesome way, to focus on wellness and prevention, is really a treat for me as well. So it's my pleasure, and thank you for the opportunity. And just very happy to help.
Wow. Thank you. On that note, thank you. And thanks to everyone joining us today. Remember that you can listen again, find this post in our guides, as well as download on our podcast, Weigh In with Gina. Dr. Andrew Feifer, thank you so much. Have a great day, everyone.